Now we're going to be moving to another very important area. Dr. Duane McBride, who is the professor in chair of the Behavioral Sciences Department at Andrews University. He's also the director of the Institute for Prevention of Addictions at Andrews. He has an extensive experience as a researcher, as a professor, and specifically in the area of criminal justice and delinquency, juvenile delinquency, sociology. He's got a PhD in sociology from the University of Kentucky, addressing issues related to deviant behavior. And so I have the pleasure of working with Dr. McBride there in the United States, as he's a board member of our Adventist Recovery Ministries and has been a tremendous influence in what we are doing with that. And so we welcome you to share with us about the social healing, social relationships and healing, so that we can learn a little bit more about that. Welcome.
Wait, how do the buttons work? All right. That way. Okay. All right, I checked. My presentation was there earlier. If it's... there it goes. She said, my name is Duane McBride. I'm from Andrews University. I'm very happy to be here today. I'm especially happy to be in Prague in the Czech Republic. My great-grandfather grew up in a town just south of Prague, the name of Písek, and had the opportunity to visit there Monday. So it's always nice to come to where your ancestors moved from, so I'm very pleased to be here. I really want to look at today, in the few minutes we have, on the relationship between social relationships and a variety of health things. What we call health status, morbidity, which is illness, mortality, death, and suggest strategies that we can use in our church to use social relationships to strengthen our health. Well, what is health? You've heard these definitions before, but they're always important to remember. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. So health is more than the absence of disease. It's also important to consider mental health, and that's a state of well-being in which every individual realizes his or her full potential, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to our communities. So it's always important to remember what is health and what is health status. It's also, this is kind of obvious, we're social beings. Human beings are social beings. Now, I'm a city kid. I was born in Chicago, where my great-grandfather immigrated. And so I'm a city kid, but my dad grew up on a farm, used to visit the farm. One of the things that really impressed me about many life forms is how fast they can take care of themselves after they're born. They really can. Well, we can't. We're dependent on others for many years of our lives for our most basic needs. We are social beings. Our language, I speak English, not because I have an English gene, but in fact because that's the language I heard from the beginning of my life. By the time I was born, my Czech ancestors no longer spoke Czech, they spoke English. So that's my language. We learn our social skills, our social values. The various skills that we have, they're not inherent but learned. We are social beings. Now, even genetics, there's a field called epigenetics. Even genetics may unfurl, may express within social environments. So it is no longer nurture or nature, it is both. It is both. Remember also, the Bible says it is not good for man to be alone. We don't do well alone. And that's an important part of what I want to talk about today. Well, the definition of social relationships, and I'm a sociologist, I've been studying kind of the relationship between social interaction and health for most of my career, and the concepts that we use in social relationships is social isolation. Well, that's the absence of social relationships, that we don't have any contacts with other human beings. The opposite of that is social integration. And that's the extent to which we are involved with formal and informal organizations and relationships, institutions. This can be marriage and family, friends, church, relatives, professional associations. Many of us are a part of professional associations, all right? And kind of the more things, it's interesting to look at some people's resumes. And I'm on search committees at Andrews, and I'm always interested to see when someone applies what they're a part of. And, that's social integration. If we are members of a church, we have a family, friends and relatives, professional associations, you're here. You're a part of formal, informal organization. Quality of relationships is also important when you think of social relationships. The quality really is their kind of positive support, emotional, physical, positive. Job's friends wouldn't count here. They weren't good quality relationships when they visited him. They probably didn't fulfill Matthew 25 when they visited the sick. Social networks, that's the web of relationships that we have in our social relationships. We're networked with each other. The professional associations, the family, the friends, those are the social networks. We also have a term in sociology that we use called social capital. Well, economists talk about capital. Well, social capital is also an important concept because it really is the sum of our relationships and what they mean for us emotionally, physically, fiscally, and opportunities. We're all networked. These are called letters of reference. That's our social capital. Who can speak for us? Who can recommend us? And so social relationships build opportunities. I always tell the freshman class when they come to Andrews, and I tell them that, look, someday you're actually going to want letters of recommendation from us. It's kind of nice if we know who you are. Take these 4 years and you develop relationships with the faculty. And also, don't ask a teacher you got a C- from to write a letter. Better to do the A teachers. But let us know who you are. Social capital is the sum of the relationships that we have that we can use. Social relationships and health status. Now, in sociology, we define health status as really our perceived health. Now, it does have an objective component, all those medical tests, what the doctors tell us, but it's also subjective. How do we feel? So our health status. And it's one of the questions that I fill out on my annual physical. The doctor gives me these forms. I'm supposed to fill this out. And, it's from excellent to, good to all the way down to barely get up out of the bed. But our health status. Positive social relationships mean better health status. Research clearly shows that high quality, positive relationships, high frequency of those relationships relate to high levels of social capital, relates to reports of better health status. And I'm an academic. I can't say anything without a reference, so you'll see my references in there and at the end if you get a copy of this. But research clearly shows those who interact with others in a positive way perceive their health to be better, and it's often based on good medical tests that show they're better also. Health status results, positive health status results from positive social relationships. Social relationships and morbidity. Okay, well, this list kind of scared me because it really shows, this is a whole bunch of literature that I quote, and a lot of these are good longitudinal studies, looking, time one and following over 5, even 10 years. Low quality and low frequency of social relationships are related to the following health problems: cardiovascular disease, arteriosclerosis, recurrent myocardial infarction, heart attacks, high blood pressure. If we don't interact positively with others, our blood pressure goes up. If we don't interact positively with others, we have high rates of cancer, delayed cancer recovery, autonomic dysregulation. Okay, I had to look that one up. That kind of means the whole body doesn't function well. It kind of shuts down. Our bodies function better with social relationships. Poor immune system functioning, slower wound healing. Who would have thought if we don't relate positively with others, the cuts don't heal as fast? Well, good longitudinal research shows that's true. Low quality relationships, poor social interaction relates to higher rates of mental illness, anxiety, depression, drug addiction. And all these studies controlled for all the variables they're supposed to control for. So this is really kind of important. Now, the flip side of that, also becomes true. That, positive social relationships relate to lower rates of cardiovascular disease, cancers, lower blood pressure, better immune system functioning. All these things relate. I began my career at the University of Miami School of Medicine, Department of Psychiatry and Behavioral Sciences. And I was on the edge. A colleague of mine was studying essentially cancer survival and recovery, and they looked at social relationships as a part of it. In fact, positive, high-quality relationships more frequently related to survival, more years of quality life. So social relationships are crucial. Well, what about mortality? Well, social relationships also predict how long we're going to live, which is a little scary. Longitudinal studies have shown that the overall death rates of those with the fewest social ties were more than twice as high as those with the most social ties, controlling for all the disease variables, social class, state of disease, all of that. That, we live longer by positive social interaction with others, by social integration, by being a friend and having friends. We can live twice as long. That's scary to me. Death rates within disease categories. A classic study published earlier in this millennium, earlier in this century, in another longitudinal study looking at cardiac patients with the fewest social ties were 2.4 times more likely to die than those with the most. Again, controlling for disease state and a lot of other variables. So, even when you look at specific disease, such as cardiovascular disease or overall death rates, high quality, frequent social interaction relates to survival. Very important thing. All right, what is about social relationships? Is it some magic thing that somehow when we're together, magic happens? No. Well, there's a couple of things that may be important that researchers suggest. A high proportion of our health status, in many ways this conference is all about that, our morbidity, our mortality are related to health behavior. Some studies estimate as much as 40%. You'll see different estimates. But, our behavior really does relate to a lot of our health status, morbidity, and mortality. Well, what is about those relationships? The following social relationships appear to relate to better health behaviors. That means better diet, more exercise, getting an annual physical, better medical compliance, less risk behaviors of all types, sex, drugs, even driving too fast and wearing a seatbelt. Well, the number one relationship that relates to health behavior for men is called being married. How many men here got a physical or saw the doctor because their wives urged them to? I want to see some hands. Any men here? All right. All right, mine too, folks. All right, so it doesn't work as well for women being married and living long, but for men, it adds years to our lives. Okay, because our wives say, look, I've noticed this, you're seeing the doctor, I've made the appointment, here's the card, you're going. Okay? So, one of the social relationships that means the most for men really is being married. I had that happen to me. I was born with an aortic valve deficiency, 2 rather than 3 flaps. Apparently that's not good, at least my cardiologist friends tell me that. And it was my wife who said, look, you've lost 2 cousins with heart attacks in their 40s. It runs in your family. I've noticed you aren't keeping up with me when we walk. I've made an appointment. Here's when you're going. I'm driving you. You're there. Okay, a few months later, I had a heart valve replaced. I'm doing very well. I may be alive because of that relationship. Having children, we also, as both males and females, as mothers and fathers, we actually make better health decisions because we have children. I've seen ads all over the world. You want to be there for your child's graduation, your child's marriage, your first grandchild. That motivates us to make better health decisions. Being employed relates to better health decisions. You see this a lot in the world. When I began my career at the University of Miami, there is no smoking bans anywhere. Now, I wouldn't let anyone smoke in my office. They had to stand outside and stick their heads in. But being employed, we make better health decisions, increasingly now in many parts of the world. In fact, at many employment organizations, you have to get a physical. And you have to have certain health data about cholesterol, blood pressure, and you have to be addressing it. Otherwise, they charge you a lot more for insurance. If our health statistics are out of whack at Andrews and we don't do anything about it, we get a 35% surcharge on our health insurance. Do you think that motivates health behavior? Yes. And that's true in many corporations. I've served on the board of other health corporations. They do the same thing. Going to church frequently, a belief in God. Social relationships, relationship with God really do affect us. The Sabbath is an amazing thing that affects our behavior. We have social relationships on Sabbath. We should never forget the assembling of ourselves together. The Sabbath may explain a few years about Adventist longevity. It's a wonderful thing. Now, I also have blood pressure problems, and I'm on blood pressure meds. I have to cut my blood pressure meds in half on Sabbath. Because if I don't, my blood pressure can be 95 over 50, and apparently that's not a good thing either. Okay, so I have to cut them in half. The Sabbath lowers my blood pressure. All right? Maybe it does for all of you. So going to church, belief in God, relationship with God, having a large number of friends we interact with frequently. This also relates to the health decisions that we make. Health behavior often is a part of interaction network, a part of our family, our friends, the church, affects our health decisions. Smoking begins in a network. Smoking often ends in a social network. I had a colleague at the University of Miami who was terribly addicted to tobacco. He actually deliberately began spending more time with me in order to stop smoking. Social networks affect our behavior. If we interact with people who are morbidly obese, we tend to become a little heavier. If we interact with smokers, we tend to smoke. If we interact with those with better diets, we tend to have better diets. So it really is important, our social networks. And what's happening in those relationships? Why are they going well? Why are they making us behave better? Well, our relationships often give us a purpose for our existence. And, I'm a sociologist, maybe, saying some theological things, but existential purpose of being really is important to humanity. Why are we here? Where are we going? What am I doing here? Well, if we believe in God, it often does give us a sense of hope and of meaning. We make better choices. If others are important to us, I want to be there for my child's graduation. I want to enjoy retirement with my spouse. We make better decisions. Also, there's social control and bonding. And we've talked about that in various presentations. We make better health decisions in diet, exercise, substance use, sexual behavior risks, to please others, to please our spouses, our children, to keep our jobs, to keep our friends, to please God. The love of God constraineth us. It's a phrase we have from the Bible. Well, there's a tradition in sociology. One of the theoretical traditions is called social control theory. And in some ways, social control theory accepts the concept of original sin. It isn't why do you do those bad things, it's why don't you do those things? Well, we don't do them because of our relationships. To please our spouse, keep our job, to please God, we do these things. So, social control, social bonding makes us behave better. We're constrained even in risk. One of the more fascinating studies I've ever done in my career was at the University of Miami, and we were taking a survey of risk behaviors of street injection drug users. Now, you wouldn't think those are particularly religious people. Well, but about 35% of them went to church at least twice a month. And so, we got some variance in religious behavior, asked about their belief in God, and about a third actually had a fairly strong belief in God, attended church at least twice a week. Well, those street injecting drug users cleaned their needles more often than those who didn't believe in God. Okay? And they actually didn't do any violent crimes. So, in a sense, an amazing, I got it published in Review of Religious Research. The review wasn't interested. No, I didn't ask. But it was amazing to me that their deviant behavior, it doesn't get more deviant than street injecting drug use. But they cleaned their needles if they weren't to church, and they didn't engage in violent crime. Longitudinal research clearly shows that when we have high quality and high frequency social relationships, we make better health decisions. We have better health status, lower morbidity, and lower mortality rates. So beyond behavior, I also noted earlier that much of the explanation for social relationships and health is in that behavioral decisions. But also every mental and physical health research shows that that high quality, high frequency, better mental health, better physical health. So it seems to be beyond behavior. It seems to be something in that interaction that strengthens our immune system, that makes us function better, that gives us energy, that makes us do better. Well, what can the faith community do? Well, first of all, we can strengthen the faith of each other. If we believe and have hope, our bodies and our minds seem to function better in decisions and in all functions. Faith matters. In those references I quoted, there's a sociologist at Harvard University by the name of Dr. David Williams. Now, he's an amazing man. If you ever have a chance, please listen to him. He's a sociologist. He's a Master of Divinity from Andrews University and a professor at Harvard University. Well, in the United States, when you're at Harvard, people listen. And Dr. Williams has done some great work that I cite in here about the role of spirituality in health. That if we strengthen our faith, we strengthen our health. Purpose of being belief in God, pleasing God, we do better, we feel better, our whole bodies function better. Be a mentor, friend, companion. Remember, I noted high-quality relationships, high-frequency relationships, including others, expanding our social networks. You know, one of the complications sometimes of retirement is we reduce our social networks. It relates to not living as long. You know, staying involved. That one of the things I loved about seeing here is there's some retired folks from the general conference that I saw who are still working a few days a week. That actually relates to longer life and a healthier life. Better longevity by staying involved. So, you know, be a friend, be a mentor. We've had, you know, a series of programs about mentoring youth, you know, but we behave better, we function better, our health is better if we're mentors and friends and companions. Maintain, expand our social networks. Avoid becoming a social isolate. I just talked about that. Maintain social relationships, formal, informal. Don't be ruled by the tyranny of the daily or become isolated in retirement. Now, one of my favorite phrases is the tyranny of the daily. I think you all know what that is. We're too busy to do anything else but be busy. You know, that, you know, sometimes I think, I get 100 emails a day. Sometimes I get so discouraged, I get days behind, then I get more stressed. You know, the tyranny of the daily can stop not only a relationship with God, but a relationship with each other. This age of twittering, of just, you know, being on your texting, having your kids do nothing but, you know, text each other. I mean, I've watched the students at Andrews, and I see them going down the sidewalk between classes just, you know, they don't see me, they don't see anybody else. I've actually stood in front of them to see if they would stop before they hit me. Sometimes they don't. You know, that's not really a social relationship. You know, we seem to need that face-to-face human interaction, and sometimes electronic media are mechanistic substitutes for the reality relationship with each other and with God. You know, we need that face-to-face interaction. Now, we live in an electronic age, we do email, but those electronic messages actually are better for our health if we have periodic social relationships, engage with each other. Be inclusive in the church. In all church programs and activities, be inclusive. Work to ensure that we include others, individuals, and groups. You know, as we serve on church nominating committees and church leadership positions, it's really important to make sure we are inclusive, that everyone in the church has an opportunity to be involved and engaged in the church. That's why Sabbath school classes, in many ways, are some of the healthiest things that we do. In fact, one of the best predictors of you not drinking or getting involved in drugs within the surveys we've done in the Adventist community is going to Sabbath school. You know, that's where we interact. We aren't passive recipients of the sermon. We're active interactions in the Sabbath school discussion. So that's a great social interaction the church can lead in. So there are issues of, you know, of service to others that are important, of engaging in service. Matthew 25, it's a great judgment scene in which Jesus says, you know, those of you that left and right, never like the left and right-handed thing because I'm left-handed. I don't think I'm that bad. But, you know, Jesus divides his people and, you know, talks about, you know, that, you know, I was naked and you clothed me. I was in prison, you visited me. I was sick, you came to visit me. And that, you know, you were sick, need of food, need of clothing, in prison. The social relationship, what we did for others, is how the judgment scene of Matthew 25 plays out. You know, if we help others, deal with others, make a difference in the lives of others, that's a social relationship. That's a part of the judgment scene in Matthew 25. One of the most interesting things I've experienced in my career, a few years ago, I was visiting Fiji with my colleague Dr. Hopkins and the new Adjunct director, Jonathan Duffy. And we were going up to the prison on a hill, large prison. On the prison wall, there was something from the Bible. It was from Matthew 25, and the quote painted on the prison wall, huge letters you could see from half a mile away. I was in prison, and he visited me. Now, we don't have the United States separation of church and state. In Fiji, they can have that. So connecting with others through service really improves our health, improves the function of others, service is crucial. Now, I have to have a few caveats. Relationships can be harmful. Again, if your social network smokes, you're liable to smoke. And, they can be harmful marriages, there can be dysfunctional families, there can be neglect and abuse. It's real. The data is overall, and we must be willing to change dysfunctional families. But overall, the research, going back to the first study I found was in the 1970s, going back for literally decades, longitudinal research clearly shows that high quality, yes, positive social relationships, frequent social relationships, being involved in life, formal, informal organizations, professional associations, relate to better health, longer life, recovering from wounds better. Amazing kind of data. And we're a part of a church that believes in these social relationships. Being a friend of others, being good to others, visiting the sick, visiting those in need and caring for those in need. Social relationships are crucial to the Christian message. The judgment scene of Matthew 25 is social relationships. What did we do? It's not just good theology. It's also good psychology, helps with anxieties and depression. It's also good physiology, immune system functioning, recovering from illness, survival from illness, even a cut we get heals better with good, positive social relationships. Thank you.
Thank you, Dr. McBride. It's often, we wonder, we look at New Start, or we're so used to doing, our regular health work that we forget that social relations is part of health ministries, right? Imagine what would happen if we started our health programs with the first program being about friendship and health, social relations and health, without talking about diet or exercise, but really talking about relationships and making friends. Amen. Getting to know people. That, I think, don't you think that would change the way people felt about us? As we were walking yesterday, we were thinking, it's about making friends. The secular society, they need to connect with us. This is what Jesus did. He mingled with people as one who desired their good. He got to know them. And, Mother Teresa said, the worst disease is not tuberculosis, HIV/AIDS. It's the fear of being lonely, unloved, and uncared for. And this is what Jesus came to do, and we heard this morning, to share his love with people who are thirsty. So we need to remember the social relationships are related to our health. And thank you, Dr. McBride, for reminding that to us this morning. In fact, Ministry of Healing, I was reading here in page 296, says, it is through social relationships that Christianity comes in contact with the people. And she says that social relations sanctified by the Holy Spirit must be improved in bringing souls to the Savior. So that's such an important element.